Today we're going to be talking about disc injuries. D for disc. People that present with a disc often have symptoms of radiating pain, numbness, or tingling down the leg, or if it's in the neck, the same symptoms down into the arm and even into the fingers. If you've been told you've had a disc injury in the past, a good thing to know is that disc injuries will heal themselves given the proper amount of time and treatment. Another thing to note is even if a disc shows up on an image, like an MRI, it does not mean that the disc is the source of the pain. It is important to do other tests to see if the disc is causing the pain or if there's something else causing the pain. The main mechanism of injury for injuring a disc is flexing forward and twisting at the same time. Those are movements you want to avoid if you have a disc injury, and also movements you want to avoid if you want to prevent a disc injury from happening. The majority of patients we see with disc injuries respond well to extension exercises. One thing we start patients off with is just lying in the extended position on their belly. So propping yourself up on your elbows, extending into the lumbar spine. Holding this position for a couple seconds to see if the symptoms start to reduce. If they do reduce, you can go into what we call a prone press up, which looks like a push up, and you're just simply pressing up into the lumbar spine while keeping the hips on the table. Doing 3 sets of 10 of these at a time can help reduce your symptoms. The things that we look for are the radiating symptoms that are into the leg start to gradually move up into the low back and what we call centralize the pain and the symptoms. A similar concept can be done in the neck if you have a neck disc injury. And for this exercise, we're simply going to do a chin tuck and then extend into that position. Chin tuck and extend. Repeating this over and over to help reduce your symptoms. Not all disc injuries are the same, so it's important to have a trained physician take you through certain movements and determine which movements are best for you to help reduce your symptoms.